Dr. Lynn DeVolio received his PhD in biomedical informatics from UCLA. He has spent the last 13 years in government, academia, philanthropy, and industry. Lynn is an assistant professor at Brigham and Women's Hospital and Harvard Medical School. He has deployed his strong academic background in the application of artificial intelligence in vital real-world projects. An example of this, his collaboration with Dr. Atul Gawande in a project designed to improve childbirth in 70 clinics in India. Through SIFT, the company he founded, he has brought a fresh perspective, new ideas, bold solutions, and a sense of meaning and purpose in making the learning healthcare system a reality. His work has been funded by numerous illustrious agencies and foundations: the National Cancer Institute, the Department of Veterans Affairs, the Department of Defense, the National Library of Medicine, the Bill and Melinda Gates Foundation, the Helmsley Charitable Trust Foundation, and now the ACMS Foundation. Lynn.
All right, well, thank you, Barry, Sarah, Howard, others for inviting me, giving me the opportunity to talk about what I think are some points worth sharing. I've had the chance to meet with a small group of you thus far, and I'm really impressed and really excited about where you are and what you now have the opportunity to do. But let's start with a story. I've been at this for some time, and when you focus on one topic for some time, you can really find yourself in the weeds, and you have to be reminded to step up and figure out, well, where does this all fit in the broader picture? What's happening at the sort of macro level? And a colleague of mine who's pretty senior, he's in sales, in retail, and he was in a meeting with a very large insurer, and the CEO had his assembled leadership in the room. And the CEO said to the leadership, you know, for the first time in the more than 100 years since we were founded, within 2 years, an outside player could enter into our space and put us out of business, in effect, beat us. Now this is the rather static retail insurance industry. And so what was it? Like, what's going on macro that would allow an outside player to enter into this person's space and pose a significant threat to their business, which has been around for more than 100 years? And he said, Amazon could right now outlearn us. They know more than we do about our customers, about the risks that they pose, about how to market them, about how to sign them up, about how to service them than we could. And with every day that passes, they continue to invest in knowing more than we know about how to do our own business. And for this reason, he was challenging his leadership to think differently about what their current situation meant. And so that sort of put it in perspective for me, because day in and day out, I'm helping healthcare systems think about how to get a little bit better in their contracts, in their performance, in their quality. And I thought, what would cause a fairly established CEO to say to his very well-established company that this is a once in 100 years event? That's macro, that's bigger. And so I started to think, I'm quite a fan of looking back at history and understanding economics to understand our present. And so what other major events have caused us to rethink what is and isn't possible, have threatened our way of being? And so you go all the way back to the Industrial Revolution, and you see that with the invention of machines and factory work, we developed a new superpower, and that was mass production. And whenever you discover a new technical capability, whenever it introduces a new superpower, there are winners. This is a picture from a very large mill building in Lawrence, Massachusetts. Lawrence, Massachusetts, at the height of the Industrial Revolution, was one of the largest, busiest cities in all of America. Everyone flocked to work in factories along rivers. And of course, the artisans who were formerly employed to create fabrics and ropes and clothing became upset. They became disrupted. Factory workers rebelled. There were winners and there were losers. And then it took another 70 to 100 years or so for electrification to come along. And suddenly, these same giant mill buildings, these meccas of industry, were no longer necessary. We could now move manufacturing, thanks to electricity, to wherever it was we could find access to power. We could specialize, we could become smaller. And these cities, this is Lawrence again, and that's along the Merrimack River. It's about 2 miles from my home. This city is now not in good shape financially. The city, the entire geography, and it's one of many in this country that was entirely disrupted by the introduction of a new superpower, a new capability. And those that understood the power of that new capability and had the resources and foresight to capture it won. And those that could not, for whatever reason, lost. And so entire cities, particularly manufacturing and mill cities, are in a real tough spot now. This is Rocky Morrison. He is the founder of the Clean River Project. Last year, he pulled 8,000 hypodermic needles from the Merrimack River. Then there was the digital era, and those that learned how to manipulate and take advantage of the ones and zeros that information could now be stored at, figured out that there was a market here. They could bring computational power into the home, and personal computers and software created levels of productivity that we haven't seen in that case, about 70, 60 years. And there were those that did not adapt. They didn't realize what this new capability could do for them, and as a result, they were on the losing side of it. And you can see that these transformative eras start to happen faster and faster as we get closer to modern times. The internet age connected everything, and those who understood what instant connectivity could be and move quickly enough to take advantage created new industries that left others behind. This is the first Amazon website. They figured out we could offer millions of book titles right then and there in the home. That was the new superpower, instantaneous connectivity, and they capitalized, and others did not. That's an abandoned Kmart. And so this theme is recurrent, and it sure feels like we're heading toward another. If you've paid attention, even the last talk, I mean, why is the College of Mohs Surgery spending so much time talking about data? Something's happening here. We're heading toward another transformational period. And what is it? Because if you can figure out what that superpower is, if you can be on the winning side of it, odds are you'll end up in a better place than those who do not. And if you've paid any attention to the media, they're hinting, whether right or wrong, they're hinting that something big is happening here. And they're positioning it very much as an upcoming struggle, us versus them, doctors versus humans, revolutionizing healthcare. And if you're not interested in what's going to happen to healthcare, you're not safe, because according to the Harvard Business Review, it will also replace lawyers, and I'm pretty sure everyone falls into the bucket other professionals. So this would seem like a really important time to take notice, to take stock. And I think we have to do so in a very pragmatic way. We need to understand the most basics of what is happening right now so that we can capitalize. What is it exactly that's happening? How will it affect you personally? And what do you need to know to thrive? And I'm going to do my best in the time that I have to at least begin the conversation in a meaningful way. So let's start with what is it exactly? And I think if it's of any comfort to you, I've spent the last 15 years working on it, helping healthcare organizations use their data to learn and improve. This slide also doubles as my conflict of interest slide, as does this. And I think what is important to draw attention to with this conflict of interest slide is I am currently employed by both surgical organizations, that are dealing with it and trying to figure out how to capitalize, but I am also employed by the organizations that pay you and are trying to figure out how they can win. And so it gives me a rather unique perspective as to what's really taking place here and how you are being positioned, both by your leadership, but also by folks that would intend to benefit from your ignorance in this regard. So let's get at it. It is not what it has been represented as in the media. It is not robotic hands handing you a magical pill. So I've started to collect these images because they're just outrageous. They're as misleading as they are entertaining. Here, you don't need to choose between the blue or the red pill. It comes rolled into one. And if there's any question as to how important this pill will be, they've made clear that DNA is involved, and that's rather fundamental. This is either handing or taking a brain. He is both thinking and he is concerned for his eye safety. I'm not even going to talk about this one. I'm just going to leave it up there for you all to enjoy. What's happening now is the introduction of new technologies, and there's a million buzzwords to describe them: data mining, big data, artificial intelligence, and so on and so forth. What it really is the combination of artificial intelligence and big data. So of all the buzzwords, let's stick with those because they're probably the most well-known, and then let's break apart what they really are. Because if you don't know what they are, you can't figure out what superpower they offer. And if you don't know their superpower, you can't begin to capitalize. The first thing to know is that artificial intelligence is neither artificial nor is it intelligent. It's math. We've had this math for over 60 years. And when you automate math, you turn it into software. So we have software that can now detect patterns from large amounts of data in ways that we could not. That's artificial intelligence. Now we'll get a little more into it. Big data is fancy vendor talk for finally using the data you've always had. You've had big data. You use claims for all sorts of economic and logistic reasons that we're not going to get into, but you've had electronic health records. You've had demographic data. You have access to much more than you've ever used in the past, and I've been at this for 15 years, and 95 to 99% of the time, big data is just finally using it. So I want to sort of dispel the rumor that it's going out there and gaining access to information that doesn't exist, that costs millions of dollars to gain access to. Here's the superpower. It is a new way of learning from data. That is as boring sounding as it is transformative and important, because if you think about it, counting has been a pretty big deal for a while now. And then we started to figure out how to use statistics to understand when we counted from two different populations, were there differences that mattered a lot to us? And that allowed us to test and prove or disprove hypotheses, and that became the foundation of knowledge and science. And now, for the first time, we have a new way of learning. And this new way of learning does not begin with experts telling it what to look for. That's this way of learning, where you sit around a table and you say, these are the things that I think matter, and this math tells you if you're right or wrong. What's really different about this math is that it begins with the outcome, and then it learns of everything I know about the people that had a good outcome or people that had a bad outcome. Of the millions of data points that I have from my big data, what are the patterns that really matter most? And that has unlimited applicability to the information science that is healthcare delivery. This math looks different. It behaves different. It doesn't have to find the 5 to 7 variables that turn out to be influential in a logistic regression. It can learn the millions of combinations of variables that make not just patients, but this patient right now, based on millions of patients like this patient, more appropriate to close in this way, more appropriate to prophylactically dose with antibiotics. It allows us to answer many more questions on a personalized basis for many more individuals than we have been able to in the past. The easiest analogy for what this math really makes possible is Google Maps or Waze or your preferred sort of GPS app. Whereas in the past, I had a static map that was created one time and never updated and didn't know who I was and didn't know what I cared about, but I could use it to get from A to B. Big data gives us more information about what's currently happening right now, and combined with artificial intelligence allows me to, on a daily basis, based on where I am right now, based on where I'm trying to go, analyze what's going on in the world, all of the data points collected all at once, and then predict which ways are going to save me time versus cost me more time, and then personalize. You stopped at Starbucks the last 10 times you made this trip. Should we bake that in for you? And that's pretty powerful. Entire industries are being born and entire industries are being destroyed because of this new superpower. Those that learn and improve faster have a tremendous advantage. And this is when this is like freaky. This isn't just about selling you more books more quickly or getting you to spend more time looking at what your friends are up to on Facebook or auto-completing the dictation that you're giving your phone or your nuanced software. This is evolutionary. This is survival of the fittest. I mean, what is evolution if not the rapid adaptation to our current environment? If you can smell that the environment is changing and you can learn what will allow you to thrive in that environment, you will outlive others. So this is a pretty big deal as far as a new capability. This isn't just electricity, which might disrupt us geographically. This is applicable across not just where to plug things in or where to ship things or where to store things or who to sell to. There's really no limitation to what the ability to learn more effectively could allow you to do if you figured out how to harness it. And that's why I believe we're entering into what I would call the learning era. So how will that affect you? I think the most obvious way to think about what people are probably already thinking about is robotic surgery. Is that right? When you think of AI and big data, do you guys think about Watson beating humans at the diagnosis of lesions faster than you can? Do you think of technology replacing humans? Because I will tell you that although there's some really fascinating stuff going on around robotic surgery and automated diagnosis, the more I've learned about your organization, the more I've learned about what you do for a living, and thought carefully about the other organizations that I work with that pay you, the more I think you would be wise to focus your attention elsewhere. If you pay close attention to what's going on around you, if you smell change within your environment, I don't think the greatest threat or opportunity is robotic surgery or automated diagnostics. I think the threat to your being is the fact that as a country, we can't afford to keep spending money the way that we've been spending it. And so the people that pay you at the government level are trying to figure out, are you worth it? And when they start to think about that, the employers and the commercial payers follow suit. I will tell you, I work with an orthopedic surgical hospital right now that is being asked increasingly to justify their existence. Now, if you're being asked to justify your existence, what is the greatest weapon you can have on your side? Information to justify your existence. There is a window, and it won't be open for long, where this value-based care thing will continue to come down at you like a freight train from government and CMS from private payers, from employers. It will come in the form of ACOs and AQCs and next-gen ACO, and it'll be disguised in a dozen plus acronyms. But at the end of the day, what it will boil down to is you will be asked to negotiate your value against someone that doesn't believe you are as valuable as you say you are. And soon, the terms of that debate will be settled. So one of these very large employers said to this orthopedic surgical hospital, share with me your patient-reported outcomes. I need to measure whether or not you're doing a good job. And the leadership of the hospital said, which ones? And the very large employer said, which ones do you have? That's an opportunity, unless you don't have them. Another employer approached them and said, we're establishing a center of excellence. We have 200 of them across the country right now. This is what we believe you are worth based on 200 surgeries you've already performed on our patients, based on their 6-month, 1-year outcomes, based on the speed with which they went back to work after you operated on them. This is the rate we'd like you to entertain. And when you entertain that rate, this is the information we will need from you. The terms of the negotiation had been set because they had the information. The more I learned about your surgery, the more it was clear to me that you may be next in line. It's knees, hips, and backs today. That's who's employing me to help them demonstrate their value. I'm sure this article is familiar to all, if not at least most of you. I'm quite sure that this was an incredibly one-sided article. I'm quite sure that you probably scrambled to come up with a response to this article. And I'm quite sure you didn't have the data you needed, and you probably used anecdote and sort of feel-good arguments as to why these guys were full of it and you're not. And that's the lost opportunity. That's what you need to be able to, that's the superpower you better learn. Because I'll tell you, again, I'm also employed by the people that are setting your rates, and they are using all of the data they can get their hands on to make their argument. This is not the list you want to be featured on. When CMS targets you as a most overused surgery, there will be policy that follows unless there's a changing of the guard. But I can tell you they're systematically working their way through different subspecialties, trying to figure out how to reduce their cost. And when they don't have data to justify, their assumption is it's not worth it. These are the types of questions that both of my customer types are being asked to answer, and both are using data to justify their decisions. Who gets to do this surgery? Is this the right kind of case to reimburse for? What should we pay you? And this is also from the New York Times article. When there is tremendous variance, the folks in charge of paying simply assume this shouldn't be happening in this way, and they don't tend to push you guys toward the tall side of this graphic when they're thinking about your rates. What if the money argument doesn't resonate with you, and you're in the fortunate position of being able to focus all of your attention at the well-being of the patient, and I would argue this should be really important to you, but we all know what influences systems. But if you're really concerned about the well-being of the patient, I think you need to be able to answer some fundamental questions. For example, what is the best way to close this patient? And should antibiotics be, just raise your hand. How many of the surgeons in this room use antibiotics in at least 50% of all of the cases they're involved with? Nobody. One person. I think you're lying. And look, this is the other challenge in doing this kind of work, is transparency is a bitch. So what do we need to do to prepare? And I want to be perfectly clear. I don't want the tone of this to be so defensive, the sky is falling. What everyone that has come out on the positive side of these big changes has realized is this is an opportunity. This is a chance to go on the offensive, to set the terms, to come out on top, to enter into the negotiation room, whether with private payers or government or employers, with the data to argue that you know what's best for your patients, and the payers and the bureaucrats and the government agencies do not. So I would hope that you would look at this as an opportunity. But if you're more motivated by the threat argument, by all means, take that to your bosses, whatever works. So we've covered this. Let's not think about AI, robotics, big data as robots placing overlords. If you need inspiration, if you need a role model for what it takes to do this kind of stuff, think about Dr. Ernest Codman. Raise your hand if you've ever heard of Dr. Codman. One. All right. A little bit of medical history for you. You're really getting your money's worth today. So Dr. Codman, in the early 1900s, was a surgeon at Mass General Hospital. He was Harvard trained. He had the outrageous idea that we should capture what we're actually doing, and then we should document who are these folks, what did we do, why did we do it, and we should follow up with them for a year to understand whether or not what we did actually worked. He called it his end results approach. He had end results card that he kept. He created Mass General's first morbidity and mortality conference where surgeons could share openly what was and was not working. He believed that this information should be shared publicly so that patients could make informed decisions about what surgeries they get and where they get them. He was fired in 1914 from Mass General at the peak of his career because people didn't like the idea of transparency and sharing outcomes. He went on to create his own small hospital. He called it the End Results Clinic. He went on to found the American College of Surgeons, he and others. He went on to found Joint Commission, at the time JCO, which eventually became Joint Commission. This is the father of modern outcomes assessment. He died so poor that his family couldn't afford a gravestone. He was ostracized throughout his career for having the opinion that we should have transparency. And on his gravestone today, which was erected in 2014, on his gravestone today are the words, "It may take 100 years for my ideas to be accepted." Now, in their biography, the American College of Surgeons credits him for all of these things. And there's a quote in the biography that his ideas were surprisingly controversial. But I would challenge you as a patient to gain access to the performance of a surgeon before they actually perform your surgery. You may have representatives within that college. Ask them to send you that information on behalf of your mothers and your fathers and your children. He was fired in 1914. It's been more than 100 years. There is an institute that bears his name in the organization that fired him. Ask them for this data. These surprisingly controversial ideas remain tremendously controversial today. The superpower is about learning in ways we've never known how to do in the past. But that does not matter if you cannot first create a culture of learning. So every time there's been a major change, new capabilities have been introduced. The winners have felt the water getting warm and hopped out. The losers felt the water getting warm, but they always had reasons why it wasn't time to hop out yet. I mean, this feels kind of nice, right? I'm getting paid really well today, but those that saw this as a strategic opportunity thrived.
Lynn, you've come to us at a very critical time in our history, and the message that you gave us today, I'm sure will resonate in all corners of this room. Thank you so much, with appreciation.